Good evening, everyone, and welcome to Have a Seat with Chris Hansen here on my channel. Once again, we're taking a look at the COVID-19 pandemic across the country. Tonight, we'll take you to New York City, the Frontlines. We'll also take a look at the restaurant industry in New York, what people are doing to survive and what people are doing to help others. As you know, in New York City, everything revolves around restaurants and taverns and the social scene there. We'll also take you to the front lines in the hospitals here in Michigan, number 3 in the nation for COVID-19. We'll have a nurse who works directly in the unit that treats COVID-19 patients at a major medical center outside of Detroit. And we'll take a look at how some people are weathering this pandemic and the creative lengths that people have taken to seek some comfort and some shelter during all this. We'll get to that later in the broadcast, but I want to start with an old friend of ours, Vincent LeVien, who is with the Emergency Task Force. Vinny works between government, the diocese in Brooklyn, and private industry. If I could have one human being tell me what's going on in New York City, he is everywhere in one day. He's at funerals, he's at hospitals, he's with police, he's with firefighters, he's serving just about everybody, and it is my pleasure to have Vinny back on the show tonight. Vinny, how are you? How are you feeling?
Tired, Chris. It's been a long 6 weeks.
What was happening today in the city? Give me a sense of the pulse.
I have to say it was a beautiful day today, so a lot of people were out. But the areas I'm going to, I started my day in Soundview section of the Bronx. The Brooklyn DA, one of the largest DA's office in the country, his detective that does his executive protection detail, her grandmother died, and they had issues in being able to bury her grandmother and making sure she had a final resting place and have a priest that could give the prayers at the burial. So I started my day in the Bronx, Soundview section of the Bronx, to meet them at the funeral home to make sure we could respect and get the family to Richmond Hill in the Queens. I was at the final funeral home. There's literally 3 funerals leaving. We get to the funeral home and we were about to leave. There was 3 funerals showing up. They do 15-minute wakes. You can imagine that. A wake is normally 3 hours in New York City. It's now 15 minutes. I'm sorry.
Did you ever think you'd see a day when we'd celebrate the death rate, the daily death toll in New York City being below 600 or right around 600?
It's very upsetting. I've been on the front lines, and as time goes on, seeing a funeral home today that there's 6 funerals in the matter of 2 hours. We get to the cemetery, and I had to basically call a priest that I know very well, Monsignor Harrington, and saying, you got to come to the cemetery to give the final burial for this amazing law enforcement official that's risked her life every day for New York City, because the DA called me directly and said, can you help and make sure we have a priest to give the final blessing for her grandma? It's surreal. The family is only about 5 or 10 people that are allowed in the cemetery. You can't have a funeral. You can't have a wake. The other family members were literally on the sidewalk mourning their loved one.
Vinny, you have provided, helped facilitate tens of thousands of N95 masks, other supplies to hospitals and first responders across New York City. Nationally now, we're looking at a death toll of 44,000 related to COVID-19. Almost half of those are in the state of New York and most in the city of New York, ground zero. Are people now on the front lines getting what they need? Do you see a difference? Are people wearing out? How is the police force? How is the fire department doing?
So thank God now, after a good 3 weeks to a month, they now have the N95s and the mask and the gloves and everything that they need. And the law enforcement, the firefighters, the doctors, the nurses, they now have an issue with gowns. So now there's no gowns because all these thousands and thousands of patients, that now is a shortage of being able to get gowns. So the protection is definitely there, but, unfortunately, and I see it firsthand every day, the toll has taken. The police officers that we had up to 25 NYPD, 5 law enforcement that have died. Firefighters are up there, close to that number, FDNY EMS. Good friend of mine, John Samuelson, TWU, representative of the train operators and bus operators. He's over 50 members of the MTA. So now the raw numbers are coming out. And it's very sad. A lot of these, as you know, I've been on your show now, Chris, for a month. A lot of these first responders, and I mean all first responders, police officers, firefighters, doctors, nurses, sanitation, the guys that are driving the bus, the TWU members, a lot of them didn't have protection early on. They couldn't get protection, the bureaucracy from the city, the state.
And these people are on the front lines almost as much as everybody else. The men and women who drive the buses, the men and women who drive the trains in New York City, which is the lifeblood of the city. I think sometimes we forget about those folks.
Every day. And I have to say, I've been on the phone with John Samerson from Brooklyn, New York, represents now 150,000 union members, not only TWU 100, but the train. And TWU is now All American Airlines, Southwest, JetBlue. He was calling me saying, Vin, I need these masks for the JetBlue flight attendants. We're having all these doctors and nurses fly in. And I need to make sure we have masks for my flight attendants, his mechanics, that are working on these planes. And I have to say, I mean, I'm trying to be very positive, Chris, now. And the beautiful thing, I mean, when you reached out to me and having Adam on the show today, you hear his amazing story. I got connected with Adam going back now a month. An amazing person, this amazing woman, AK, Alexandra Kamens, and she connected me and said, I have this guy that wants to help, has a pizzeria, wants to keep them open, wants to provide, pizza to first responders. I mean, I'm honored to work with him. He's going to talk to you about what he did, but this guy single-handedly has delivered over 9,000 pizzas to literally every single hospital in New York City, every firehouse, every police station, the Javits Center. I provide the cars and the drivers. I literally have Rob Rich, who you know, professional photographer, that literally takes pictures for celebrities. I said, Rob, you want to drive? He's like, Vin, I want to help. Here's a guy that has no business, right, because there's no events, driving a car to the hospitals to drop off pizzas because he wants to give back.
Vinny, do you think we're turning the corner here in New York City?
I hope so. I mean, for the grace of God, what New York and what the families have been through, I hope so. I've seen it leveled out. There's not a lot of admissions. The doctor I saw today, amazing doctor, Dr. Lawrence Haynes, that literally has been on ground zero in Maimonides. The ER room and the emergency room in Maimonides is kind of leveled out. The doctors and the nurses have done God's work. To see them and see the doctors and nurses today, I mean, my God, 5-6 weeks later, he hasn't seen his children in 5 weeks. His wife, Dr. Chrissy Haynes, is a doctor at Lenox Hill. He's a doctor of Maimonides. His kids are in Miami right now with their in-laws and his sister-in-law. They've been watching his kids for 5 months, for 5 weeks. You imagine that? Leaving your kids, and for 5 weeks, you're there, you're in the ER, literally on the front lines, risking your life. His wife's in another ER, risking her life. I think it's leveled out. Javits Center that we've been going to every day. Thankfully, we got the call that they don't need any more pizza because they've leveled out. They're only about 400 patients, thank God. The USS Comfort is about 300 or 400 patients. I think, thank God, the doctors and the nurses are getting a little a breather. They're leveling out on, Chris, I don't even want to talk about this. We were at 800 deaths, 700 deaths last week.
Oh, yeah.
500. I don't think 500 is good or 400 is good. I think, unfortunately, I've been dealing with it now. There are a lot of people that didn't go to the hospital, Chris. And I'm dealing with law enforcement. The people, just like I know, there's people that are in their homes that didn't want to go to the hospital. And now they're trying to reach out to those people and they can't reach them. So you're going to have, doctors and nurses that, they have patients that got discharged or didn't come in, and parents and family members that can't reach loved ones. And there's people right now that they're searching for that are missing.
That's tough stuff. Vinny, I'm going to have you stand by because I want to bring in Tracy Birchmeir, who's a nurse at a major medical center in suburban Detroit. Tracy normally works in the intensive care cardiac unit, but is now working in the infectious disease unit, specifically taking care of COVID-19 patients. Tracy, thanks for being with me tonight.
Hi.
How you doing? How you feeling?
Stressed.
I bet.
It's getting better, but it's definitely it's a different situation than I've ever been in.
You had the day off today. You're heading back in tomorrow. Give me a sense of what you left behind after your last shift.
The unit that I'm on, there were about 40 patients, and these are the sickest of the sick. And and I anticipate I'll go back in with a heavy load. There's the way they have it split up, or the way that we're doing the model right now. You've got 10 ICU patients, 3 ICU nurses, 2 moderate care nurses, and then hopefully floats that help you out. But it's definitely, it's difficult.
When you say the sickest of the sick, give me a sense. Are these people going to make it in most cases? Are you seeing people recover, or is this end of life care?
We have been seeing them recover, but not like what you would think. They need to be vented first. Some of them are being trached. I mean, they're not going to go home how they're not going to go back to their normal life. It will take a long time for a lot of these people to get back to what their baseline was. Some people will probably never, ever get back to baseline. It's definitely, it's scary. These are all vented patients. They're all, we're proning them. We're doing everything we can. We're paralyzing them, doing all kinds of things just to get them through, this rough patch and then start to recover.
What do you do to prepare yourself mentally, emotionally to go to work every day?
Let's see. Try not to think about it too much, honestly. I try not to think about what I'm going to walk into. I know it's not going to be great. It's definitely, you hope that you have a good day. That's about it. You just hope that you work with a good group of people and that you're going to have a good day.
You and the other nurses and the doctors are, in most cases, the only other human contact these patients have. There's no family visits. Do you find yourself having to orchestrate some sort of a FaceTime call or Zoom?
We do.
Call?
We do. We do that actually often. Before patients get intubated, we will try and FaceTime them or Zoom. Our issue is that we're running into is that the hospital's providing iPhones for them, for us to use with the patients. And some of these patients, they're on the Android, and so we're challenged with technology. That's like the biggest issue. But we're always, able and available to help them out and try and facilitate contact with them. It doesn't always work out. Sometimes people get sick so quickly that we can't let them. It just doesn't work.
What surprises you the most about this disease, this virus, as a medical?
The biggest surprise for me is that no 2 cases are alike. It's not like anything I've ever seen before, and I'm not a pulmonology nurse. I do the heart. I mean, they all work together, of course, but every case is different. You can't expect every single patient to respond the same as another patient because they just don't. And when they get sick, they get sick. It's, they could be sitting there talking to you with 2 liters, and 3 hours later, you're doing everything to keep them alive and keep them breathing. It's sudden.
Has there been one thing in terms of treatment common that has worked for the majority of these patients, or is it just a matter of throwing everything at them to see what sticks and what works?
It's everything. You can't, what works for one does not necessarily work for the other. And we see that one all the time. I mean, with all the drugs, all the medications, all the different treatments, vent settings, you never have the same patient following the same course. Everybody, it's doing whatever they respond to, whatever you can throw at them that they will respond to.
So sometimes it's the antibiotics, sometimes it's the ventilator, sometimes it's just putting them in prone positions, sometimes it's sedating them.
Sometimes it's paralyzing them.
When you say paralyzing, what do you mean, Tracy?
Using a paralytic that you would use when somebody's being intubated. They get a small push of a paralytic to help the intubation go smoother. Whereas sometimes we will actually put them on a paralytic drip and keep them paralyzed to let their lungs recover and let the machine do all the work for them.
Give me a sense of the range of patients you've seen, age-wise, male, female.
Well, my last patient was 28.
28.
And a mom, yeah.
A mother at 28 years old. And is she still with us?
She was when I left.
And how
She
serious?
You know, you just don't know. I don't know if she'll be there when I go in. All different age groups. I've seen as young as 26, a gentleman that was 26, no history, and he was fighting being intubated when I left, and it was an all-day thing trying to get him to breathe well enough that he didn't need to be intubated, and he didn't want to be intubated, and we don't want to intubate them, but if they're not breathing, I mean, if they're not oxygenating, then yeah, they're going to get intubated, and so it's constant.
You're obviously highly educated, incredibly well-trained, well-read, practiced. You've been at this for some time. Do you ever ask yourself, why? How did we get ourselves into this situation? I mean, a virus is a virus. I get it. People have predicted pandemics of large scale for some time, but this is something we've never seen before. 40 years I've been a reporter. I've never, ever seen anything like this.
It's funny you should say that. I had a text conversation with a friend today, and we were both making those comments like, you know, we just don't even know how to respond to this. And, you know, this is actually a second career for me. So I've been at this for about 10 years now. No, I could never have anticipated this. I would have never had thought something like this could happen. Does it surprise me that it's happened? No, it doesn't surprise me.
Why not?
But I just think that with everything going on in the world, to be honest with you, I would have thought that we would have had some kind of major disaster before a pandemic, because we're so more advanced, you know, with medical science and research. But no, it doesn't surprise me. I think that there's a lot. I don't think that the knowledge, you know, what we're finding anyways, or what I'm reading on the news, and hopefully it's all as accurate as can be, but I don't think that the knowledge, you know, being passed from from different countries is as accurate as it could be, you know, to prepare everybody for these things that are coming on, or as quick as it could be. You know, I know the World Health Organization, they're trying. I know everybody is, but I just feel like we could have been a little better prepared for something like this. But in the same token, it doesn't surprise me that we weren't.
Here in Michigan, as you know, there's been a lot of grumbling about the stay-at-home, the lockdown, the shutdown, the governor's decision to limit activities. Do you think the state of Michigan, and I don't want to get political here, but do you think generally from a procedural standpoint, using your medical mind here, do you think that everything has gone as it should have gone?
I think that everybody in Michigan has tried to do their best. I think we have not flattened our curve for sure, but we've definitely slowed the curve down. My biggest concern now is that we're going to see a second wave, that when people, you know, quit following the stay-at-home order and everybody's, you know, out and about, I think we're going to get that second wave of patients coming through. And it's just because it's happening later on down the road doesn't necessarily mean we're going to be able to treat it any better.
What do you think we're going to need to do to avoid that severe second wave and to indeed flatten the curve and turn the corner here? I don't want to make it that simple, because it's just not.
It's not.
Or in New Jersey or New York or Washington, D.C. or anywhere else. But what's it going to take, and how long do you think it's going to be?
I honestly don't see us getting back to normal for years. We're going to have a whole new normal. Oh yeah, I think we're going to have a whole new normal. It's going to take a long time to recover from this. I honestly don't know how we would make it better. We certainly we can't not live. You know what I mean? And I feel sorry for everybody out there that's, you know, having all these hardships and financial difficulties. I'm grateful that I'm not experiencing that, but I just feel like it's going to take a long time for everybody to recover from this.
Is it going to take a vaccine?
The vaccines. So another nurse asked me if I would get a vaccine as soon as it was offered. And I said, I would have to see it tested on people. Yes, it is going to take a vaccine. I would hope that, we're getting closer to it. But yeah, it's going to take a vaccine. It'll be like the flu vaccine.
And the flu vaccine, depending on year to year, is only sometimes 50, 60% effective.
Yeah.
Looking at the same thing here. And what's your biggest concern about the early use of a vaccine having to do with COVID-19?
I think that this is something that we don't know enough about yet. Nobody knows enough about COVID-19 yet. Certainly not the nurses. I mean, the doctors are learning more and more, and so are the nurses, and so is everybody else. But I mean, what do we really know about COVID-19? The only thing we know is that it doesn't behave how we want it to behave, that patients don't recover how we want them to recover, that every patient is different. You can't just follow a path of treatment that you would normally follow for any other kind of normal disease. So I don't know. I don't know.
What did you think when you saw pictures of people protesting in the state capital of Lansing here, way too close?
Yeah.
Concerned about the shutdown order. And again, this is in the great scheme of things, a very small percentage of the population here in Michigan, but it was a vocal show to the point where it made national news.
Oh, yeah.
What do you see folks who are out there doing this?
I have all kinds of thoughts about that. The one thing that really bothers me is that nobody, I feel like those people aren't considering the fact that these orders are in place to keep them alive. You know what I mean? I mean, nobody wants anybody to die from COVID-19. That's just not, we just don't want that. And I feel like those people that are marching, that are, putting themselves out there, are definitely at risk. And I feel like they're putting others at risk. And I feel like it's selfish. I'm in a hotel room right now. I had my daughter who lives in New York City. She came back to Michigan. I all but begged her to come back to Michigan to be here before they got locked down. So she's been here for 4 weeks, and I don't want to share this with her. So I'm living in a hotel room right now. I get it. It's not convenient. No disease is ever convenient.
So you're actually living in a hotel room to make sure you don't take anything home from work to your daughter or the rest of your family at your home in
Correct.
Suburban Detroit.
Correct.
And what protocol do you follow once you leave the hospital?
I take off my shoes. The first thing I do is take off my shoes and switch out and put on a pair of loafers. When I get to the hotel room, I drop all my clothes, get right in the shower, get as clean as possible in the hottest water possible, and then I just call it a day.
And you get carry out there at the hotel?
Yeah, or else I eat at work. They do provide some meals, and we've been gifted with a lot of donations.
How many more shifts do you have in you, Tracy?
Well, there's talk about this unit going on indefinitely, and I signed up for an 8-week stint on this unit, so I don't know. I'm wondering if I'm ready to go back to my regular cardiac unit or if I'm going to stay on the COVID unit.
After giving this some thought, and we're 5-6 weeks into it, can you say in your own mind with any medical confidence who is most vulnerable? We talk here in Michigan and in New York as well about the senior living facilities and trying to move these people around, and in some cases trying to do something positive and actually spreading the virus from one area to another. Is it the elderly who are most vulnerable? Is it the young people? You hear
I think it's
all the time.
I think it's people with multiple a long medical history. It could be anybody, honestly. I mean, we see it with people with no history. We see it with people with, I wonder if your DNA makes a difference, to be honest. I mean, it affects people differently. So I'm for sure worried about all the older population because they're our most at risk. And then of course for children, but it doesn't seem to go after children like it does, the older population. So it's hard to value one age group over another, or to say one's more at risk than another, because I think we're all at risk.
We heard Vincent LeVien talk about the husband and wife surgeon team in New York City. We hear from you committing, giving your all on the job in a very dangerous situation. Also in Detroit, there was a 5-year-old girl who passed away just in the last 24 hours. Mother and father, police, fire department people. It just makes you shake your head. How do you keep that focus, that positive attitude to show patients that, okay, you need to stay positive as well in an environment where you have no family around you and it's just you, the medical professionals in this hospital room, this unit?
Well, I have to say, I don't see those patients. Once we get those patients well enough to breathe on their own, we move them off of our unit. Nobody's really recovering on our unit. Our unit is, primarily patients that aren't able to, voice their concerns, or they're not at that point where in their recovery process that they're, even feeling isolated. They're all sedated, they're all vented, or they're all so weak from this disease that they're not thinking about those things.
Do you ever get a chance to see your patients after they recover, or are you too busy on with the next critical case?
No, I don't ever see them. I don't see them move out. If they do move out, I don't know where they go afterwards. I don't follow them. I can't, and for all kinds of reasons. I mean, we hear things, that gets passed along, whether it's from a doctor or a family, or somebody calls up and says, "Oh, well, you guys took care of so-and-so, and we just wanted to let you know that they're home and they're doing well." But that's it.
Tracy Birchmeir, I'm going to have you stand by with me just for a few minutes here. I want to get back to you with some more questions, but I want to switch over to New York City now. And Joseph Smith, who is the owner of Bobby Van's, a string of very successful high-end steakhouses in New York, Washington, D.C., and North Carolina. Joseph, thank you for being with me tonight. How are you doing?
Well, Chris, thank you.
As I don't have to tell you this, restaurants, taverns, pubs, the center of the universe in New York City, you're shut down. Is that right?
Completely, yes.
All 9 restaurants.
All of them.
What impact has this had on your business, Bobby Van Steakhouse, and the entire restaurant industry in a city like New York City? 8 million people depending on it.
It's had a huge impact, but I think it really hasn't started yet for the restaurants.
Really? What do you mean it hasn't started yet? You've been shut down.
We've been shut down for 5 weeks, and I think when we open, that's when the fun and games are going to begin.
What do you mean by that?
There's going to be a lot of restaurants that can't open, because if you're paying high-end rents like $70,000 a month, my places are anywhere from 50 to 70, and you owe 3 months rent, and the landlord's not willing to forgive it, you're $250,000 in the hole, and then you bought all sorts of food, and steak is very expensive, dry aged for 6 weeks. A couple of $100,000 there, you're going to open up with a $500,000 bill. How are you going to pay for that? They say we're going to get help. 5 weeks, I haven't seen a dime. I have 340 people that have been furloughed. I would think 200 of them still haven't got unemployment. They haven't been able to get through. The lines are not working. It is a bad state. It is not being run properly.
340 employees, and you think 200 of them probably haven't gotten their unemployment yet. What is that doing to their lives?
Well, I try to bring as many as I can in, different ones on Fridays, and give them some cash and whatever food we have left. Right now, we're completely out of food because they've taken it all. We've given it to them to try and help them. Some of them have got 3-4 children, and it's a big struggle.
It's no secret that in the restaurant industry nationwide, but especially in New York, that a lot of the employees would be technically considered undocumented residents of this country. They may present a document that suffices for an employment, but these are good, hardworking, honest people with families, children who are U.S. citizens, and yet they're caught in a bind in terms of what their status is. And we're in an environment where it really isn't that friendly to undocumented residents of this country. What's happening to these people? And you know some of them very well, and you know them to be hardworking, honest humans.
Some of them have been in this country 10, 12, 15 years, working 2 jobs a day. 2 jobs. They could do lunch in one place and they could do dinner in another place. And they work 5, 6 days a week sometimes to support these families. They could have had 3, 4 American-born children, citizens of this country. They pay Social Security, they pay taxes, and they get nothing. They're getting no help from anyone except the handouts that I've been doing on the meat that I had left over. I couldn't freeze it because you can't freeze meat. It's just a waste of time. And I sold it at a big discount, and I got money to try and help these people out. And this is what they've been surviving on, and they're very, very grateful. But it's a really tough time.
You hear about all these government programs and the billions of dollars that the administration is supposed to be providing to businesses like yours. You hear about Shake Shack getting millions of dollars and then returning it because it didn't need it. You hear about Ruth's Crisp getting $20 million. Have you seen any help from the federal government yet?
I've only seen it on TV, but nothing in my bank accounts or nothing anywhere else. And not to defend Ruth Chris, they got $20 million, but they have 150 locations. So if I'm furloughing 340, they're furloughing 6,000, 7,000 people. And it breaks down to about $110,000 a restaurant. That's what they got. Now, $110,000, if you get that there, the government wants you to bring back your employees, and they're going to pay 80% of their wages. But what good is it to bring them back? You're going to have to pay taxes on that, on their salaries. You've got no work to give them. You can't give them, but what are they going to do? The places are already spotless. They've been cleaned. There's no food in the place. There's nothing to cook. What are they going to do? Play cards and collect money? So it's stupid that what they're doing is taking them off unemployment, where those that are getting it are getting $1,100 a week, $500 unemployment, $600 more, $1,100 a week. They work a 40-hour week at $20 an hour. That's $800 minus. They're on $1,100. The government wants to get them off that to give them to me. So I pay the taxes on their salaries. So I pay 20% of their salaries, and they're not going to do any work.
What would you do? You've been in this business a long time, 9 restaurants, 340 employees. What's the answer here? Is there an answer here? How do we help guys like you and other restaurant owners survive?
There's going to be a lot of restaurants that don't survive. There's going to be a lot of guys that think right now they're on the Titanic, and we know what happened to the Titanic. It's the government. It's talking about giving airlines money and taking a piece of them and stuff like that. They're going to see. At the same time, you can't blame the landlords, because the landlords have a mortgage. They got 80% mortgage on the buildings, and you live in New York. I know you very well. We know the size of the buildings, and they have huge mortgages, and they have tenants. And if the tenants don't pay their rents, they can't pay their mortgage. So how's it going to get fixed?
How is it going to get fixed? What do you think from where you sit?
I've spoke to a lot of my customers are Wall Street guys. They're financial guys. And we talk, and they don't know. Nobody's got a clue. The government's going to have to solve it by throwing money at the landlords to forgive the rents. The rents have to be forgiven. And our insurance has never covered this. We have insurance for drunken drivers. You don't get a drunken driver in a restaurant, but if he drinks there and goes outside, we have insurance for fire, for everything, but not for this.
Did you ever think you'd need an insurance policy for a virus, Joseph?
Well, the last breakout of a virus, there was I was told there was some sort of a clause in it that a lot of people got money for the last 8 or 9 years ago when we had the flu or whatever it was.
H1N1.
But after that, the insurance companies took that out, so they couldn't ever get caught again. So there's no insurance for it. This has never happened before. We're all sitting here and people are guessing what's going to happen. If the restaurant opens and they say, okay, you can have 50% of the seating, 50%, and you can't be 6 feet together. You've been in my restaurant. You stood at my bar with me. Could I put 3 people there? No, I can put 30 people there, but they're going to be shoulder to shoulder.
Elbow
So
to elbow.
what's going to happen? I'm not going to be allowed to do it. I can put 120 people in the dining room, but if I go 6 feet apart, I can put 40 people in it. But yet my electricity bill is the same, my insurance is the same, my rent's the same, and my payroll will be up there too, at least 80%. What do we do?
You heard the governor of California talk about restaurants reopening in phases, and maybe you'd see waiters with rubber gloves and face masks and disposable menus. Does that work? Does that help? Do you see that as reality in New York City?
I wouldn't go to a restaurant if the waiter was serving me with a mask and rubber gloves and a menu with a piece of paper. I'd rather stay at home. I'd order Adam's Pizza. That's what I would do, and I would enjoy it.
We're going to talk to Adam in a minute.
And I would enjoy it very much. You know what I mean? No one's going to eat under that, especially a high-end restaurant.
Right.
See, if you watch the TV, it tells you the restaurants are doing this, the restaurants are doing okay. Burger King's not a restaurant. McDonald's is not a restaurant. We have restaurants. A pizza place is a pizza place. There's a lot of takeout places here in the Upper East Side that are doing great. Small little places that wouldn't normally do. They don't even have tables or chairs, but they're doing good business now with takeout. You can't go into a restaurant and somebody's wearing a mask. You're better off staying closed.
Joseph, you've done very well for yourself, but you came up the hard way. Immigrant from Ireland, tough, scrappy, started at the lowest levels of the restaurant business and really made something of yourself with a high-end steak restaurant, 9 locations across the country, mostly on the East Coast. Did you ever, in your wildest fear, think you'd be staring this down?
No one had any idea about this thing. When it broke out in China, and yes, our president played it down a little bit, but so did I. I thought it was another case of a bad cold or something. I don't get sick, as you say. I go to the gym, I'm in shape, I eat properly. I thought it was just more hype. But then I think when we all discovered that it was something, I think the president acted fast and he did the best he could do, and government did. Governments did. New York State did the best it could. I didn't agree with everything on how they did it, but the world has got this. It's not just the USA. It's in Ireland. I mean, there's people dying over there of it. A nephew 2 weeks ago died.
Sorry to hear that, Joseph.
Yes, but it's people all over the world. We just heard Tracy there talking. What a story. I mean, what a phenomenal story that everybody's stepping up to the plate. People actually say good morning to you now in New York when you're walking down the street at 7 o'clock to go to the gym. They're saying good morning to one another. The last time I saw that was with the World Trade disaster. And that was the only time. But now Vinny was on and he's telling you all the things that they're doing. New Yorkers are tough. They're a tough breed of people, but they've also got great hearts. And they're out there helping one another. So we do what we can do.
Joseph Smith, I want you to stand by with me for a few minutes, and I want to bring on Adam Elzer, who has part ownership and runs the Sauce Pizza outfit in New York City, as well as a few other restaurants. Adam, thanks for being on the show tonight. How you doing?
I'm great. How you doing?
Good. Hey, I just want to ask you something personal right off the top. When we were getting warmed up for the show, you asked if you needed to be on for a whole hour because you want to spend some time with your 6-year-old son, from whom you've been quarantined because of health issues. How's he doing? He's 6. You must miss him.
He's 6. He's doing great. He's been quarantined a few days before this actually broke out in New York. He has a heart condition, so he's high risk, for corona. So we've been keeping him in New Jersey at my parents' house, and he's been away from everybody.
And you got a chance to play your evening Uno game with him online?
Yeah, we play Uno every night on FaceTime, which is great.
And who won tonight?
He won 2 out of the 4.
That's great. Adam, give me a sense, you've got a pretty big restaurant chain of your own here. Did you see this coming in the early stages? Did you think it would get this serious?
I didn't. The week that it was kind of coming out, I was buying concert tickets on Monday night. And then on Tuesday, I picked up my son from school. And on Wednesday, when I dropped him off at school, it kind of hit me that I saw a kid in his class coming into school sick. And I called Ford's mom and I said, I think that maybe we have to take him out of school because I'm worried about his condition and potentially getting this corona thing. And from there forward was when I started to really take it seriously. But up until that point, I wasn't thinking that the city was going to get shut down or that we were going to be, closed down.
As a restaurant owner in the city, as we talked about with Joseph Smith, these places are the center of the social universe, part of the DNA of the city. When did you see the shift come as a restaurant owner?
Well, the weekend before they told us that we couldn't have customers in the restaurants anymore, you could kind of see the shift. But it was when the city made it official, that you couldn't have customers inside and you could just do takeout, and delivery business was obviously a huge hit. I mean, the next day we furloughed 60 employees. We have 2 full service restaurants that are more sit down, and then we have our pizzerias. So,
and how many employees do you have altogether?
We have about 100.
About 100. And how many have you been able to keep on?
We have about 40 that are still with us right now, still working every day.
You've been providing literally thousands and thousands of pizzas to hospitals and first responders in New York City. How did this get started, and at what level did it start? Take me through it.
Well, it started, my business partner, Perry, we were on the phone and he was explaining to me that a friend of ours, Ariana, who works at Cornell, had written us an email and said that she was on double shifts, that she didn't have time to be making meals for work, and that none of the restaurants were open, and she wanted to know if we would send pizza to the floor. So Perry and I decided that we would just send a bunch of pizzas up to the hospital. I brought the pizzas to the hospital, and I could kind of see how crazy the situation was inside and how nervous and kind of exhausted the staff already looked, and how busy it was at the front, and how you couldn't get past security. It was just kind of a nightmare. So
how did that hit you when you saw that? How did that hit you?
It made me realize how important it was to support the hospitals at that moment, because these doctors and nurses are saving, our sick families' lives. And in my view, they were the front lines of a war, with something that we had never seen before. And, I wasn't convinced that everybody, signed up for this type of a job description. So, when we left, I was speaking to Perry, and we decided that we were going to send 20 pizzas a day to a hospital just to support a different staff. And then we put something on Instagram saying that if our customers donated a pizza, that we would bring an additional pizza to a hospital. And, that kind of kicked it off. I think 2 days after we started, I met Vinny, and Vinny came with the emergency task force, and he provided us resources so we could start to deliver more pizzas to more hospitals. He provided us drivers and cars and really helped us get everything operational. And then that weekend, my landlord called me and he said, he saw what we were doing on Instagram, and he said, I've never been so proud of one of my tenants. And he actually gave us free rent in the pizzeria space.
Have you ever heard of anything like that in the history of the restaurant world in New York City?
I mean, I had never spoken to Douglas before that. It's a huge real estate company, A&E. I think they're one of the biggest landlords in the city. And he called me early on a Saturday morning, and he was really excited about what we were doing. He said it was the most hopeful thing that he had seen that week, and that he wanted to do whatever he could, to support us and to keep us going forward.
And Adam, as we sit here tonight, how many pizzas have you delivered to first responders, doctors, nurses, firemen, police officers, people on the front lines?
Today we're over 9,000.
9,000 pizzas.
9,000. So we figure that 2 slices is a meal. So we're thinking that that's about 36,000 meals that we've delivered into hospitals.
How does that make you feel as a New Yorker?
I'm proud of it, and I think that even more so, this really started because we think pizza is a fun thing. Pizza generally makes people smile and makes people happy. So it was nice to be able to bring something into the hospitals and to see the nurses and the doctors, smile and kind of get a break and know that they were going to have a meal. I think that was one of the most rewarding parts. That, and I mean, the messages that we've gotten back are incredible.
What's the most heartfelt thanks that you've received in all of this?
A friend of mine who I hadn't spoken to in about 10 years, she wrote me a text message at 2:30 in the morning. And she told me that her father had just passed away from COVID, and that her brother was in the hospital with a coma with COVID, and that her and her mother were looking at Instagram and they saw what I was doing, and that they were really happy that we were doing this, that it made them feel good that we understood that taking care of these nurses and doctors was essentially taking care of the 6 families. She explained to me that she had to talk to her dad and say, basically everything was over FaceTime. They can't go and see, their family. They can't be with them. And that was a pretty inspiring message. I mean, it at first I was kind of overwhelmed with it. And then I called her and I spoke with her, and, we were able to go to that hospital and to, donate pizzas to the unit that her brother's in and to the unit where her father passed away. And just kind of, honor him by continuing our mission and trying to continue to make, nurses and doctors' lives a little bit easier through this.
How long do you figure you'll keep doing this?
We're going to keep doing it until we stop getting notes from nurses and doctors telling us that they need it. So whenever we get a note, we add the hospital to our list. And then every day, Vinny has drivers at the store. The emergency task force has been amazing in helping us carry this out. Our marketing director, Allie, puts the whole thing together. So she's on the phone with, nurses and doctors, and she's putting it in. Our director of operations, Matthew, has been amazing. He's kind of organizing the whole thing with the stores and making sure that we have enough dough and making sure that everything's going to be on time. So we're going to keep going. And this week we decided to do a partnership with City Harvest as well. So we're going to start.
Tell me about that. So City Harvest obviously provides food to people who can't get it on their own. And there are a lot of people who are distressed during this period of time. How's that going to work for you and for City Harvest?
Well, I run every day. So when I go running, I usually run by one of the churches that's on 9th and B. And the line for people waiting outside that church to get food is 3 city blocks, a full avenue, 3 more city blocks. It's really crazy the amount of people that are standing waiting in line just to get some food. And the problem is that a lot of people lost their jobs. That church is in, one of the areas of New York where there's a lot of low income housing. And there's just a lot of people that don't have the money to buy food right now, so they're slammed, and they need people like us to kind of step up and to support them and to show up when they're busy and to help provide meals. So that's the partnership, and we're just going to continue to do that along with all the hospitals.
Do you have the financial wherewithal to continue this as long as the city of New York needs it?
I don't know. I mean, we didn't get approved in the first round for the PPP loans. So that was kind of a huge blow for us. Hopefully they'll put some more funds into that, and that will be something that could help, carry us through. A lot of people have been really generous and been donating. So people go on our website, there's a link to our GoFundMe campaign, and they donate that way. So those donations have helped a lot. But really, I mean, we're going off of faith. I think that we all believe that we're doing something that's important. And I think we all believe that we're really helping the city right now. And, you know, being in the city through all this and kind of watching it, you know, continue to change and continue to happen, it feels good to try and help. And I'm not a doctor, I'm not a nurse. I don't do that, but it's nice to be able to support them. And I think also looking at our streets in the East Village and downtown, it's just, you know, the next part of this mission is going to be to start feeding people that need food.
What is the new normal in New York City going to be from your standpoint?
I think everybody's going to have to wear a mask. You know, I think that that's something that you have to accept, and it has nothing to do with you. You have to wear a mask because you're protecting other people. So if you are sick and you don't know it and you're wearing a mask, then it's a much lower chance that you're going to spread it. And it's the same thing with gloves. You know, for our full service restaurants, it's really scary. I don't know how you go to a restaurant and you eat in a restaurant with a mask on. You know, we've been thinking about that a lot, but I think mask and gloves is going to be the first step. I think that there's going to have to be somebody who steps up and creates testing facilities, you know, where you can walk in and you can get a test and, you know, you can be sure that the result is true. You know, so that you can go and see people, especially if you have family and friends that are vulnerable. You know, for me, I've been in this thing, I've been in hospitals, I make a lot of the deliveries myself, you know, and I got my first test last Friday and I was fortunately negative, you know, for COVID, but it's going to be testing and masks and gloves and people respecting those rules, because in a city like New York, there's never going to be enough distance between us where we're not going to spread this thing. If we go back to life the way that it was.
Adam, I'm going to have you stand by with me for a few minutes. I want to bring in Stacy Swanderski, who is a retired police detective from Farmington Hills, Michigan, a suburb of Detroit. Stacy also works in intelligence and investigations, and I know her from a couple different stories that I'm working on currently. And she's with her mom, Pat, and they're in Myrtle Beach, South Carolina, and in their RV. And I just think it's a wonderful story that you're with your mom, that you decided early on in this that you were going to get out of Michigan and take a vacation adventure. And here you are in an RV park in Myrtle Beach with your mom, your dog, your toys in your RV, and you're on the Atlantic Ocean. Who's got it better than you tonight?
Definitely. I think both of us. And I feel truly blessed and lucky that I was in the situation that I was, to be able to take Mom, to take Scarlett and say, look, you know what, I'm concerned that things are going to get pretty bad around here in Michigan. Mom has some issues, high blood pressure and cardiac issues, that I was really scared she would be more of a high risk patient to get COVID. And I said, come on, we're going to pack up the RV. We're going to pack up my toy hauler, packed it up with Scarlett, my shepherd, who was just bouncing around there for a moment, and brought my motorcycle down. And we found a place in Myrtle Beach called Ocean Lakes Campground. And I couldn't be more lucky, or we couldn't be more lucky. We're second sight off the ocean. And honestly, I think we figured, heck, if we're going to be looking at four walls of our a house, I'd rather look at the four walls of this RV and be able to look out the window or hear the ocean and walk the beach. And it's a wonderful place here. It's 310 acres. Really, there's only 17 RVs here. There are homes that people do rent also and own. But we're blessed with a mile-long beach that's dog-friendly. I take Scarlett every day on a 6-mile walk, rollerblade around the park here, and most importantly, keep my mom safe. That was number one priority.
Stacy, when you left, and Pat, I've got some questions for you to make sure Stacy's behaving herself on your adventure there, like Thelma and Louise, sort of. But Stacy, when you left Michigan, did you have any idea that this pandemic would reach the levels it's reached? You're in law enforcement for more than 2 decades and continue to be in investigative work. Did you ever think we'd get to this point?
I was, to say to this point, to see what we're at, 32,000 cases, I believe at this point, or even maybe higher today, as of today. I can't say that I thought that it would get, I knew it was going to be a hotbed. We have so much international travel in and out of Michigan with the big three. In that whole Tri-County area, a lot of people that travel internationally. That was my main concern. And at the beginning of March, I said, I think we need to go. I think we need to make sure and figure out a way to isolate ourselves, isolate first, most importantly, mom, and make sure that we stay healthy. But I can't say that it's hard still being retired and having so many friends, not only in Michigan, fellow officers at Farmington Hills that are, and also Farmington Hills Fire, that are, fighting the battle of this invisible enemy. And my heart goes out to them, and I think of them every day. It's hard because I have it so great here, and they're working their butts off and, facing this invisible enemy head on.
Now, your sister is a doctor in the middle of all this, and your mom was living with your sister. Was that part of the reason that you wanted to get your mom away from Michigan? Because
so my mom, it's actually my mom's sister. My mom's sister, Jan, is a doctor. Right. Yes, and she's right in the front lines, doctor that treated Detroit Fire, Detroit Police, right there on Jefferson in downtown Detroit, and that was just a huge factor. I was concerned with Jan coming back and forth and then being at risk herself. And that's kind of like that hard part where you want to be there for your family if, God forbid, if they got sick, in which she did actually get sick. Luckily, she tested negative, but she was down for a couple weeks, pretty bad.
She's still not.
She's still not. Yeah.
Still having a tough time. Pat, how you doing down there? You having fun with your daughter?
I'm doing fine.
That's my wingman.
I'm just so lucky to have someone that could do this for me and take care of me like that. You often wonder when you have children, are you going to be by yourself when you get older or not? But no, both of my daughters have always been great with looking after me and taking good care of me. I'm so blessed.
But it hasn't been all vacation down there. I hear you had some rough weather blow through. Stacy, tell me about that.
Yeah, I know we get some pretty good storms up in Michigan and tornadoes that whip through. But I'll tell you, this southeast section of the United States, they get some craziness down here. And last Sunday, actually, what was that? On Easter Sunday, they came knocking on the door of the RV at about 4:00 in the morning and said, "Listen, we've got tornado warnings." Some what they call heavy weather or straight line winds. So bottom line, we got dressed, packed up the dog and jumped in. We have a golf cart because they don't allow anything motorized aside from your regular vehicle. And we jumped in the golf cart and got down to the bathhouse that they have, regular showers, the bathhouse, which was great because it was like a little bomb shelter. I mean, and we had some heavy straight line winds exceeding 114 miles an hour come through. And we ended up being in between two tornadoes. And thankfully the trailer was fine. Everybody's fine. Everybody here at Ocean Lakes was fine. But it was a little bit of an adventure.
Do you feel isolated there? Did they shut the area down at some point as we got further into this pandemic?
Yeah, we've watched when we got down here, a lot of businesses were still open, and we were able to do regular grocery shopping if we need to. However, they stopped certain things here in the campground. There's a large pool, there's a recreational area, there's playground area. All that has been shut down, and they've been following the advice of the governor here, McMaster's, I believe is his name. The beach, thankfully, we've been able to utilize the beach. That truly has been. You say put a little sunshine on yourself and you just feel 100% better. And that's so true.
All right. What do you say to the folks back in Michigan, Stacy, Pat?
Wish you were here.
Yeah, we do. We wish you were here. We love you and miss you all. And stay safe, stay strong. And,
keep our fingers crossed that this will get end soon.
Yeah.
You're gonna stay put down there for a little bit, I take it? Yeah,
we're staying put and riding this out, even if it goes into May. And I won't send too many pictures more from the beach or video.
All right.
So,
All right.
but,
well, Pat, maybe we'll get your sister Jan, the doctor, on next week on the show to talk about her efforts in downtown
Thank
Detroit. All right. All right. You guys take care, and thank you very much for being on. I want to return
Thank
to Tracy Birchmeir just for a minute, our nurse who was kind enough to join us tonight. Tracy, any final thoughts tonight? Anything you want people to know as you prepare to go back into the hospital, into the medical center tomorrow and do your shift? What do you want people to be thinking about tonight?
I want them to realize that it could be them that I'm taking care of. It doesn't matter your age. It doesn't matter your gender, your ethnicity. None of that matters. You could be my patient, and I don't want you to be my patient. I don't want to take care of you. I want you to be healthy and outside of the hospital. So, really consider when you're going out and about and when you're, marching and lancing with a whole group of people that you may become infected. I don't need that kind of job security. I don't need to see any more patients die. I've seen enough. I've been doing it for a long time, and I want everybody to be healthy. I want everybody to wash their freaking hands,
I think that should be the new motto here. Wash your freaking hands.
Yeah, it should be. It just should be. Nobody does it enough, I want people to consider, everybody's talking about how much everybody else is helping out, people are donating, the restaurants, which is so very, thoughtful and nice. And I really understand. My daughter lost her management position at a restaurant in New York City, so I get it. But everybody needs to remember, you staying home isn't just affecting you. It's helping everybody. Limit your groups. Don't. I know it's hard. I get it, but consider that. Just because you're helping out by donating food or donating your time or volunteering for something, help us out more by, not putting us in the position of maybe having to take care of you.
Well, Tracy, thank you very much for being with us. God bless. Stay safe. We'll keep in touch with you as we continue reporting on this. And I'm going to bring Joseph Smith and Adam Elzer back on here. Gentlemen, most important tonight, when this is all over, can you find a position for Tracy's daughter in the restaurant business?
Absolutely.
All right. All right, guys.
I don't know if we'll have a restaurant to put her in.
Well, if you've got one, I'm going to hold you to it, Joseph. All right.
Okay.
All right, gentlemen, final thoughts. Joseph, anything you want people to know tonight about all this?
No, maybe the government might want to know that we need help. That's about all. I mean, the people, as Adam knows better than I, have been terrific. And the people like Adam doing what he's doing, kudos to him. I might call him on Thursday with a little surprise.
All right. Well, that's why we put these shows together. It's education and networking as well. Joseph, thank you very much. I'm going to have to get back to New York at some point soon, and I will see you when I get back. Take care of yourself.
You got it. Thank you.
Adam, final thoughts for you tonight.
I hopefully the government approves some more funding for the PPP. It doesn't seem like a lot of the small restaurants and businesses that needed it got it. It seems like we were all kind of in the back of the line at some of these banks and we didn't get approved. So hopefully that comes through. And, I think right now, it's a very strange time, but I think we're going to get through it. And I think that, doing your best to help is important. And I think that this situation changes really every single day. So if you're paying attention, I think that almost everybody can find a way to help someone else out. And that's going to be the fastest way to get through this.
All right, Adam, you hang in there. The best to you and your 6-year-old son. I hope he stays healthy, and we'll keep in touch along the way. Have a great evening and stay healthy yourself, all right?
Right. Thank you.
Vincent LeVien, the one and only, the glue that keeps all this together in the city of New York City. First of all, thank you very much for being here. Thank you for what you do. What do you want people to know most tonight before I say goodnight to you?
I have to say the most thing. You look like a person like Adam and Joe, true New Yorkers that could have stayed home, could have been with their families. Adam hasn't seen his son in over a month because he's out there literally helping the first responders that are saving lives. And I'm very proud of everybody that's working on my team, Adam, and everybody that's out there every single day to help save lives. It's something that I will personally never forget. I think me and Adam will be brothers for life, because we met in a time that, a lot of people had a choice, and he stood up. And I'm very proud of you. See the New Yorkers right now in New York City. They're standing up and they're going in every day and they're continuing to help. And they're missing out. Like I've missed out on, 4 weeks of not seeing my wife and my kids. I deal with the phone calls every day, when I'm leaving. And I have 2 young kids, a 6-year-old and an 8-year-old, Sophia and Vinny Jr. And we've sacrificed, immensely. Adam has sacrificed immensely. Dr. Haynes, Chrissy, and, Lawrence sacrificed immensely. There's a lot of people that have sacrificed so much, and they've given so much. They've given their lives to save people and help people. And I think that's the most beautiful thing to me that I'll never forget, Chris, is in a time of tragedy when thousands of people are dying, when people could have been running away from danger. A lot of people stepped up and stepped in and have been going towards danger. A guy like Adam, I have to say, I helped him get tested so he can see his son from 10 feet away, a son he didn't see for a month that has a pre-existing condition. I mean, it's a beautiful thing. He could have, you've got Joe Smith, who's a legend in New York City. You look at like a guy like that. They could have closed up shop, but he went out of his way to sell the meat that he had left in his restaurants. And it still comes back to New York City to try and help. I think that's, to me, I try and stay very positive right now. I wake up every morning like everybody else does, and you see what's going on. And to me, it's the Adams and the Joe Smiths of the world, and the doctors and the nurses, Dr. Haynes, that I saw him today. Because I saw in his eyes after a month. This guy was more determined than he was when he started a month ago. Haven't seen his kids. Him and his wife go home. They're 2 ER doctors. And, it's just an amazing thing to see. The guy's at Maimonides Hospital in the heart of Brooklyn. And the guy is in ground zero in a way that I've never seen before in the medical field. And the guy's been there for a month. And he said, Vin, I'm going to be here until it ends. That's to me is the most beautiful thing. New Yorkers are always tough. They're fighters. They get up every morning. I think it's one thing about New York. People come from all over the world to come to New York to see how it is. And it's a beautiful thing to see New Yorkers that's stepping up. My last thing I did tonight was went to Rayo's, the famous Rayo's that you can't get into. The guy Dino, who's a chef, and I picked up food for my guys. And my dad, as you know, was a police officer for years. My brother is a colonel in the Army, and he would take my brother into the mess hall, and they would sit with the privates. My brother's a colonel, and my brother's like, why are we sitting with the privates? And my dad said to my brother years ago, you take care of the troops, they'll take care of you, and they'll take care of the mission. And so we left the city tonight. Everybody got a Rails bag, Junior and Rob Rich and Detective Lynch. And we all went home, to have dinner with our families, and not forget what's the most important thing right now is to stay safe so we can continue getting up every morning and help, the people that are saving lives.
Vincent LeVien, as always, it's a pleasure to have you on. Thank you for everything you are doing. We will stay in touch, and maybe we'll get a couple of those doctors on the show next week. I appreciate it. I feel blessed, particularly, to have these people come on this show and take us to the front lines of this insidious pandemic, and I appreciate it very much. What a group. What a group of people dedicating themselves in so many different ways. And you talk about restaurants here in Michigan. We know people who own restaurants. They're doing the best they can. In New York, it's the part of the DNA of society. It's such a vital aspect of this. Tracy Birchmeir going to go into her medical center tomorrow and put her life on the line, literally, to help save COVID-19 patients. Everybody else involved here, Stacy, who whisked her mother away to South Carolina. Wonderful, wonderful story. All of them. Thank you so much for being on this show. Thank you for watching this show. We will continue our regular Have a Seat with Chris Hansen tomorrow night, same time, 8 o'clock, where we'll have our continuing investigation into Davi Vanity, Jesus Torres, and Onision. Thanks again. Remember, I'll be watching, and I'll see you here again when you have a seat with me tomorrow night. Have a pleasant evening.